Pulse oximeters are small devices that are used to measure the pulse rate or the heart rate, which is the number here. Beside the PRBMP, and the oxygen level in a person's blood, which is the number here. Beside the SpO2 percentage. Here's how you use it. Open the clip and place it on the index finger in the oximeter. Be sure that the fingernail is on the same side as the red light and that the finger is inserted all the way into the oximeter, as the light beams must pass through the nail bed to give the reading. The normal heart rate is 60 to 100 and the normal oxygen level in the blood is 95 to 100%. Remember not to put an oximeter on fingers with dirt or blood, as they may block the light beams. The oximeter may not give a reading if the person has nail polish on. If you can't get a reading on the fingers, you can try putting the oximeter on toes. Pulse oximetry readings are not always accurate. If a person has a low body temperature, has a lot of motion like shivering or sneezing, a low heart rate, is dehydrated, or has dirty hands, readings may not show up on the oximeter. Use the oximeter readings with caution, and always use your own judgment during an overdose response. We will now demonstrate how an oximeter can help during an overdose.
When responding to an overdose, after tilting their head back and checking their airway for obstruction, the next step is to give rescue breaths. We will first talk about how you could use an oximeter when providing breaths. Then we will talk about what happens if you don't feel comfortable giving breaths. First, ask yourself, is the person breathing slowly, less than 10 breaths per minute? Second, are their lips or tongue blue? If yes to any of the above, give rescue breaths at 1 breath every 5 seconds. Clip on the oximeter and let the readings generate while you give breath. After giving rescue breaths, supplement your assessment of the person's breathing and color using your oximeter. If the SpO2%, which is the oxygen level in the blood,
is less than 92%,
more rescue breaths are needed. The next step is to administer naloxone. Give 2 doses if necessary. If you don't feel comfortable giving breaths, give naloxone right away. When in doubt about the substance used, always give naloxone. Naloxone will reverse opioid overdose but will not work for benzo, and person who is overdosing on benzo will remain unresponsive for longer. Lastly, continue to monitor the person's breathing rate, color, and blood oxygen levels using your oximeter until help arrives. Here's how you clean your oximeter at the start and the end of your shift. This is important to decrease the spread of infectious diseases like COVID-19. To clean your pulse oximeter, use an alcohol wipe to clean the inside and outside of the oximeter. Let it dry thoroughly before use.
Which oximeter reading corresponds to oxygen level in the blood? A. Percentage SpO2 or B. PRBMP. The correct answer is A. Percentage SpO2. Which oxygen level reading suggests more rescue breaths are needed? A. Below 97%, B. Below 95%, or C. Below 92%. The answer is C. Below 92%.